Thank you, Madam Chair and other subcommittee members. I represent the Texas Association of Community Health Centers and myself because I'm a physician and have done a few things in the past related to care of people. As far as the Texas Association of Community Health Centers goes, there are 71 centers across the state that take care of roughly 1 million people, a little bit over 1 million people, and 50% of those are uninsured as of last year's statistics. 72% of those have a poverty level of less than 100% of the federal level. There are 350 sites. We exist in 115 counties. So we have quite a bit of experience with this population that everybody's talking about today. I'm going to actually cover 3 points fairly briefly, but they're all linked to one concept, and that's that in our country, with our system, healthcare coverage equates better health. There have been study after study after study that shows that, going all the way back 20 years. Coverage equates better health. Now, you have to have access in there. So the first point I'm going to talk about is the issue of needing help. If there's 6 million people in this state that are uninsured, and whether it's 40% of them or 50% of them that would be eligible for Medicare, Medicaid under the expanded model, you're going to have a system that can take care of that. And that means the private doctors need to be engaged. It means that many others need to be engaged, because remember, we're only taking care of 500,000 of those right now, and I doubt you're going to get a lot of expansion dollars from the federal level at this time. So you're going to have to look at that process, whether you'd make a decision about this or not. They're going to end up in the emergency rooms if you don't. There are just going to be a lot more of them there, and entities like FQHCs won't be able to do anything more. The other concept is cost sharing, which is in this bill, 3376. The uninsured that we see in every other FQHC around the state that's of this uninsured already has a cost sharing mechanism. They have nominal copays. So it's not going to be unusual to them. The third point that I'm going to address is quality. And a few weeks ago, I was actually in my own representative's office, and this issue of this Virginia study came up, and I said, well, that's interesting. And I said, what's the citation? Could you provide it for me? He didn't get back to me. Well, I heard it again this morning. So during the recess, I did some research for you. I read medical articles all the time. The actual abstract of that has been handed out to you. The only authors that are held to rigorous science are the authors, the only ones, so you can see what their outcomes and their conclusions are. And I also provided a PolitiFact check on how that article is being used. So I'm not going to say anything more about that. You can read that yourself.
Representative Coleman.
Thank you, Madam Chair. And I believe there was another PolitiFact that was done on some comments that were made by Senator Cruz that made the same thing. And this one rated the discussion on this paper half true, and the rating on PolitiFact on his statement was completely false.
If I remember correctly, there was a Washington Times article that was rated completely false by PolitiFact, and there was some alluding to that article as to what resulted in the later PolitiFact one that you're talking about, Representative.
Thank you.
Thank you.
Thank you very much.